viral infection, and the main organ that is affected in COVID-19 infection is the lungs. As we all know, whenever a patient acquires this COVID-19, it is through the respiratory system, that is the aerosols or the viruses, they are inhaled in the respiratory system, and once they are inside the lungs, they start causing the damage. But it's not like that if it is affecting lungs mainly, it cannot affect other organs. So heart is definitely affected. With whatever studies we have till now, with the experience world over, mainly from China and other Western countries, it has been found that almost 30% of the patients who were admitted with this infection, they did have cardiac presentation. Now, when I say cardiac involvement, it can be in different forms. The most commonest form that is they are coming across is patient getting chest pain, having a decrease in the blood pressure and increase in the heart rate. In medical terminology, if I have to talk, there are different cardiac presentations that can be myocarditis, that is the virus affecting the muscles of the heart. It can be the myocardial infarction, or what we call it as heart attack. Now the pathogenesis or the mechanism by which this virus causes heart attack, it has been described. It is said that because of the infection in the body, there is increase in the stress in the body that leads to increase in the release of the hormones. Those are catecholamines, what we call it as, that is adrenaline and noradrenaline. And because of this increase in the hormones, there is increased workload on the heart, and that precipitates a heart attack. Then there is increased tendency of formation of blood clots in the blood vessels of the heart and in the lungs. And then rarely patient can present with deep vein thrombosis or the blood clot formation in the lower limbs, which can migrate to the lungs and cause pulmonary embolism. Some of the patients did present with sudden increase in the heart rate. We all know our resting heart rate is like 70, 80, 90. When we exert, when we have any kind of stress, it increases to 140, 150. But in certain conditions, this heart rate goes to suddenly to 200 or 250. Now, whenever the heart rate increases to 200 and 250, the effective pumping of the heart goes down and there is sudden drop in the blood pressure. In medical terminology, we call it as ventricular tachycardia. And if not treated immediately, this ventricular tachycardia leads to sudden death. So many of the patients did present with sudden cardiac death and what we call it as ventricular tachycardia. So these are the different presentations of the COVID-19 as far as heart is.